Hi, my name is Dr. Ben Gold. I'm a pediatric gastroenterologist. And what I'm going to try to do for you in this segment is to talk about nutrition with respect to inflammatory bowel disease. IBD, as it's called for short, not to be confused with IBS, can either be Crohn's or ulcerative colitis. A lot of people talk about medicines, pharmacotherapy we call it, in treating inflammatory bowel disease. And here in the U.S., we're a seek and destroy society. We come up with the biggest, baddest drug to get rid of the disease, or at least, in this case, to cause remission. I like to propose to you that, in fact, nutrition, proper diets, good selection of nutritional sources can, in fact, be as effective and sometimes better with respect to treating the inflammatory bowel disease. In particular, nutrition can be delivered either orally, so the patient taking it by mouth, and it can be a specific diet. There are actually diets that have names and have been studied in clinical trials. The specific carbohydrate diet is one of those. Or it could be diet that's a balanced nutritional diet in conjunction with their medical therapy. Third, the nutrition can be given by the form of a tube, whether it's a flexible thin tube that goes in the nose and hangs into the stomach, called a nasogastric tube, or a tube that's in fact placed in the stomach and goes in directly through the stomach wall. That's called a gastrostomy or a G-tube. Through tubes, or if the patient is brave and hardy enough and can able to drink the amount of calories they need, they give liquid formula or liquid nutrition that can support their inflammatory bowel disease. Studies have shown, and I've seen during my career as well as my partners, that nutrition given properly and in a well-described way that's then managed can actually help their disease become more quiet, go into remission, and in fact also enhance the most important aspect of this, which is the growth and development of the child. When it comes to tubes, the nasogastric tube can be inserted by the nurse or clinician. Usually it's by the nurse. And the patient, in fact, can be taught themselves and or their parents. And in fact, I have children, I have a 10-year-old who puts in his tube at night, hooks it up to the pump, starts running the formula, stops it in the morning when his alarm goes off, pulls it out, goes off to school, and the next day comes back and does the same thing. And he does this 5 days a week. He has a holiday on weekend, and that's his therapy for his inflammatory bowel disease. I have other patients who aren't as adept with putting in tubes as this particular patient, and so they'd rather go to school with their tubes. I have a 13-year-old girl who in fact has developed a nose ring. She keeps the tube in her nose and hangs it over her ear, and she has it neatly decorated so it looks like a piece of jewelry rather than just a flexible nasogastric tube. The bottom line is nutrition can be used both as therapy but also as a supportive source of healing for the child or adolescent with inflammatory bowel disease.